I would like to introduce our next speaker. We are very delighted that today we have with us Professor Farida Fortuner. Did I say it correctly? Fortune. Professor Farida Fortune from Queen Mary University in London, the UK. She's an oral health, she specializes in oral health. And the most significant thing I read when I was reading her bio is that she was recognized as one of the top 5 most influential Muslim women in the UK. And we were very delighted to have her here with us today. And we're looking forward to listen to her presentation about delivering health and education advocacy locally and internationally. Farida, the professor, it's yours.
Can you hear me now? Yeah. Hello. So my name is Farida Fortune, and I'm from Queen Mary. I have lived in the UK most of my life, but I was born in South Africa. So I've worked all over Europe, Asia, and I don't like to say Africa because it's so large in a lot of African countries, and have a particular view of what the sustainable goals should be doing. If you have a look at this picture, you will notice, I don't know if there's a pointer on here, that we have huge poverty and inequalities, whether you are in the United States, in the UK, or any of the other countries, whether they developed or not. So it's always a misnomer to think that because you're from Europe or from the USA, there aren't any problems, but they're actually on your doorstep. And so, is this the pointer? Yeah. So, do you know where this is? Yeah, anyone just say? Which country is this from? Okay, I'll tell you, otherwise it will be too long. So that country here, and here, and here, here, here. They're all different countries and different cities. This is the USA. This is the USA. This is the UK. Right? This is South Africa, where people were taken from their land, dispossessed, and dumped in an area. This actually is in South Africa, in Cape Town. It is not in the leafy suburbs of New Hampton or in Surrey, right? It's a huge lesson for us to learn that there's health inequalities. You've all been on the tube today and got stuck. That if you move from central London, you all know where Oxford Street is, it's about here. And you move to where my university is in here, there's 20 years of disparity in life expectancy. It didn't seem so bad in 2010. We haven't got any better. Isn't that awful? That you can go 10 minutes on the tube, you live to about 90 years on this side, actually, and you die in your 70s on that side. And this happens all over the world. It will be the same in Cape Town. If you're living in Bishop's Court on the beach, same as in London, in Kensington. If you're living in Gugulethu or in Cape Flats, same as Mile End around my hospital. No wonder we have 49 languages spoken in our thing. Don't take anything for granted. Look at your own doorstep and do not make assumptions about other people's, where they live, their cultures, okay, their expectation, their education, because they're in Africa, they're in Asia, okay, not at all. Okay, so the problem with poverty, it breeds huge inequality. And gender, sex, disability, religion, geographical position all play a part. So if I told you that in the UK, Most of the diabetes were in the Muslim population. Would you believe that? Why should that be? Because they are actually one of the most disadvantaged and poverty groups. Tower Hamlets, where I work, 7% of all the BMEs have diabetes and only 5% of whites. But that's when you're in your 20s. When you're 65, 42% of the BMEs have diabetes and only 18% of the white population. What about oral cancer? That's a rare disease, 2% of all cancers. Why do we have 11,000 cases each year? Underrepresented, because once patients are diagnosed, they walk out of the door, they go to Bangladesh and go to India, all right? One of the reasons is the smokeless tobacco, which you will find in Sudan, you will find in Somalia, you will find in Ethiopia, you will find in Yemen, you will find in North Africa. Smokeless tobacco is a huge problem in the Muslim countries and Muslim communities. Right. What about cardiovascular disease? Overrepresented in the BMA population. Whether you're Afro-Caribbean, whether you're Muslim, whether you're Bangladeshi, whether you're Christian, they all have coronary artery disease. They have the highest mortality. Okay, the fifth, if you take the Muslims out, they have the fifth highest premature mortality in the UK. Okay, cardiovascular disease accounts for all deaths, and it's sobering where I work to see men dying of heart attacks in their 30s. So I had all the sustainable goals up, but I've taken that out. I simply want to look at and concentrate on healthy lives and promote well-being, at equitable quality of education and lifelong learning, which we had excellent presentations this morning, and the resilient infrastructure and sustainable innovation with ethical basis. We would say that good health and well-being and having equity of education is a basic right for all. But is it a right for all, and do we all have it? I would argue to the contrary. What the UN has to do is actually, we keep on saying we're going to have health and education, but you've got to empower, you've got to motivate, and you have to build resilience in everyone. Okay, so what do? Advocacy is important to me. At Davos, they appointed 17 eminent people to influence governments. So what do we see on telly? We see all these wonderful actresses, actors, people with loads of money. They have a view on what we should think and do. But nobody has asked the man in the street. Advocacy, I would say to the UN, is so that everyone has a voice. That advocacy has to be from the ground, locally led. It's got to be inclusive, all right? It has to result in people being empowered, and with the being empowered comes accountability. That governance and ethics is really, really important. This is these kids in Zimbabwe. So there's been a huge amount of problems there. Zimbabwe has a higher literacy, do you know, than in the UK. Even with all their problems, 90% literacy. What do we have in the UK? We were talking this morning, if you have 60, that's a lot. Look at what these kids have done. Okay, when the schools were closed, can you see they've made a pool board? And if you play pool, the proportions are exactly correct. They can do this without being trained, without having technology, without going to school. So this kid, what else can this child do if they had your education, your food, clean water, and good health. That child, even though they're in Zimbabwe, they might be in Somalia, they might be Sudan, Ethiopia, they might be in Syria in the war, but that child can change the world. And we have to recognize that's where the power and that's where the sustainability of our existence lies. I'm sure you all saw this young chap who didn't have grade 3 education. He built a car. He put a system in place. Okay? So what do? So from my point of view, we define the healthcare and education on the local needs, and it's delivered not by the NGO that comes from outside, the NGO from inside and locally. And the key to any success of anything we implement, if we're taking big projects to any of the countries, is to make sure your sustainability is the local ownership of both the knowledge and leadership, all right? And this should be a fundamental element of your project delivery. And I thought that Shamim Mantubwa had made a very, very important point, and it's a pity she's not here to have presented her study so ably. So it's not rocket science. Engaging localism, okay, local communities. Localism is really important for your strategy, objectives, which should be set by the local community, not you coming from abroad or not you coming with a lot of money, right? And when you finish your project, you must leave sustainability. Although the UN says you should, how many projects have been taken all over Africa? How many projects have left something sustainable? Very few. You go to the Gambia, somebody might have been there, they finish a project, 5 years, they move. They go and do TB somewhere, finish a project, 4 years, they move. You are raising aspiration and expectation. And when you go, there's nothing. So people get very disheartened, and you can see that people and countries now are saying, well, I'm not quite sure. And I was involved in a big 12-country project, and actually Uganda was saying, we don't think the ethics is good enough on this, all right? Because it looks like the data's traveling out and no data's staying in. And all of you should be saying exactly the same. Okay, you can do this. I'm not going to talk about virtual organizations because we've had quite a lot said about that. But actually technology, when it's used correctly, is extremely powerful. Okay, and you can deliver technology from that handheld $25 pound telephone, all right? And Open University use an SD card. You can use all sorts of things. They used banking in Africa, peso, way before we got anywhere to mobile banking. And the peso system's much better than ours. Okay, so these are loads of projects that I've been involved with and delivered and made sustainable. But I want to talk to the projects that local people have done. And all I've done is act as a facilitator abroad. Okay, so clean water for all. Look at this. Clean water, and you know it's going to last because they built the borehole. They inserted it, all right, and they decided how the water was going to be delivered and through the community, not somebody from outside. Now, I'm not quite sure how I start this. How do you start the... yeah. Do I just press on the video? Yeah, so just... Yeah? Right. Okay, so I just wanted to show you how powerful is that. Okay, there's one guy goes to all these schools and he tells these kids, you're powerful, you can do it. And those are the children who came from the Cape Flats. Right? He's been doing it, he's been keeping stats, he's been looking at his outcomes. Actually, it's better than anything we could have done. This is another community-led social interaction. It's children who lead their families. So they look after the families because the parents have died of HIV/AIDS or other chronic disease. They take them out and they give them quality time over a weekend. And a weekend is all these kids have, right? Because they take all the children, somebody looks after the younger group, the older ones, and they give them education that's tailored to their needs. 1 weekend, okay, every 2 months, right? It's maintained these families, both the children who are looking after them and the children who are coming up have stayed in school. I didn't do anything. I just helped facilitate that. And now 3 of the children have actually gone to university. 3 of the 3 children have gone to university. Have you ever heard of that? No. These are the people that live in the drains at night. Okay. Medical camps, how do you deliver health? I have this massive clinic with all these accoutrements. But what people need is basic healthcare. They need their sight, they need women's health, you need your pediatric clinics, right? And this is started by a group of women. They used to help deliver food to the schools and then found out nobody's actually doing it. What did I do? Just facilitated it. They have such good outcomes. On my first slide, you would have seen somebody with an eye patch, all right? Women got doctors from abroad, came in, all the ethics was done through the government with the local doctors association and university, and they had 450 people have their cataracts removed in 3 days. And the elderly woman there had not seen for 40 years. And that's really powerful because that now has resulted in this. This is sustainability. So they had the figures, they could show what they were doing, and they went out and Islamic Relief saw this and came and said, and it wouldn't have mattered if they were Muslim or not, and came and said, we like what you do. And they said, build us a clinic. And they said, we can't build you a clinic, but we'll give you half of the money. They raised the rest. They've got a 14-room clinic, and you can see it's all really very well fitted out. Oops, fitted out. Okay. Again, this is a girl in Cape Town who came to London. You can stay here, when you're 26, you can stay here for 2 years till you're 26. And she thought, you know what? The people I know have all these skills. So she goes around the shops, takes photos of all these dresses, sends it back, raises money. They have the fabric. They make better quality clothing. They then sell it. And the only thing that they need to do is to actually, it's like a pyramid structure, then give money to another group. And she follows that quite well. You know, and so she has this thing. If you do this and you engage people, you can end poverty, okay? You can get a social upliftment. And this project, again, nobody important has been hugely successful. I'm not going to talk to you about remote diagnosis and guidance, but just to show you, you can do it anywhere, okay? And we've trained surgeons, okay, via a mobile broadband to do really complicated operations. We should do more of this. But again, build a governance structure around it. I want to tell you the story about Ebola. We now have people dying of Ebola again. We only heard of the 2014-16 because there was a health worker that had died or became very ill. But nobody talks that about 10 years before, 5,000 people died in Mozambique. And Mozambique is actually quite a small country. And now people are dying again. Excuse me, WHO, but I'm part of a global network, Diaspora group, of people from all over Africa. And everyone was really shocked. We have a meeting once a year. And David Morano, who comes from Sierra Leone, he said, you know what, I don't think, he's at Imperial now, I don't think people can understand the WHO manual. I can't. We got it. Okay? There was about 70 people from academic backgrounds. Nobody understood it. He sat down and wrote a 16-page document and then a 4-page document for health workers. What we did was, all of us had a job to send 3 out, okay? And we pinged that all over West Africa. Somehow one ended up in New York, and I got an email and said, my goodness, I now know what to do. So how can we make all these judgments about these people? They don't look at borders, they're dirty, they just wash their people because they're going to bury them. Actually, it is really, really important. Recognize that if you just give people a bit of information, they will know what to do. And I'm sure this 50 years down the line would show that this has actually made enormous contribution. The amount of feedback we got from churches, from mosques, from schools, saying, now we know, we didn't know how to deal with this disease because the old people who saw it before were no longer here. Sorry, and I'm going to finish. So please, to the UN, support African scientists. They're as good as everyone else. And please, can we have collaborative scaling? And governance to governance is really important. Thanks.
Thank you, Professor Farida, for this very educating and very inspiring presentation, talking about the sustainability, definitely the power of internet bringing people closer, and the youth in Africa and the ingenuity that have shown that year by year, and the fact that internet is no longer a luxury, it becoming a basic human right for people education and people health and everything.
So please remember, if we all help and do a little bit, it will make a big difference.